All right. So I will try to review faster, so that's why you guys can go. Okay. You have a clinical rotation today, right? Not yesterday, but today, right? That's what I remember.
Yes.
Yes.
Okay, good. So at least you have like a 1 day holiday. All right, let's going back to the reality. So you're gonna have like a quiz on Tuesday. Okay, and we also have some kind of like an unfinished PowerPoint on Tuesday. Okay, the first question, the vaccine schedule. Okay, and the second question, the dose calculation. Okay, is exactly the same question, and we're gonna have we have a before in the class. It should not be that so difficult. Okay, as long as you remember and you know how to calculate, and you will get the points. All right. So for the number 3, the infant feeding program. Okay, how we feed the infant. Is that good? We use like a small and frequent time.
Yes, and then you put their head up.
Or
Yes, true. Okay, put the head up. Okay. Do we need to dilute the formula?
No.
We don't. Yeah, actually, we don't dilute the formula because you want to dilute the formula become like a more lots of water, and we just want the whole formula and for the baby because remember they are not growing. That's why they need a calorie. So that's why when you dilute the formula, actually the calorie is not going to be enough. So remember, okay, please do not dilute the formula. But if unfortunately we want just have a formula just dilute with some more water, so which one we should dilute? If unfortunately we have to, we dilute with the mother's breast milk. Okay, you can dilute with mother's breast milk. So breast milk is okay, but not just dilute with the water or with some other thing like a juice, like some sugar water. No, we don't. Okay, so the feeding program, we usually just use it like a small and frequent time, and more frequently, and we try to finish within maybe like a 30 minutes with one small can and do it many times. Don't just feed it too long. Because when we feed it too long, the kids usually get tired and fall asleep during when you're feeding them. So that's why they are not really eating. Okay, so number 4, tetralogy of a fellow. After the need to chest position, so what intervention we should do? Can we get some oxygen?
Yes.
Yes, we can give some oxygen. Okay, no problem. Do we give a medication? Usually that's by the doctor's order. Okay, if the doctor didn't really say that, then it's which is not really necessary. So how about incubation?
Yes.
Well, remember, if I didn't say it, that means it didn't happen. So I never say congenital heart disease. We need to incubate the baby, right? So that means what? This is not necessary. It's not. So incubation have lots of complication, okay? Especially this is a heart disease, it's not really a lung disease. So incubation usually is not necessary. So don't incubate the baby. Okay, we just monitor them, and when they grow up a bit more, that's why they are ready for heart surgery. Okay, so number 5, congenital heart disease receive digoxin therapy. So what kind of signs and symptoms we should monitor? This is exactly like adult. Okay, it's just a pediatric question. So we need to monitor what? When we just taking a
Heart
digoxin.
rate.
Heart rate, yes. For the adult, it's below 60, we hold a medication, right? For baby, usually for how much? We need to hold for sure.
100.
100 years. Some textbook will say like 110, but our test will say like 100. Okay, but just let you know, like between like 100 to 110, this is kind of like a range. Okay, if it's below this number, usually we need to hold a digoxin. We cannot give. So digoxin toxicity for the baby. Okay, so what should we monitor? The baby, what kind of sign symptom will happen? Toxicity.
Vomiting.
Yeah, nausea, vomiting, exactly like adult. This is exactly like adult. Okay, it's nothing different. So the kids will have a nausea vomiting episode, and also the potassium if it's low during the lab draw. Okay, if the lab value and is showing the potassium is low, we also hold a digesting. Okay. Number 6, post-cardia. So catheterization, intervention, and monitor for what?
Bleeding.
Breathing, yes. The breathing sign is less than how much? In the adult, we say the breathing sign is less
A
than
dime.
yeah, a
A
dime.
dime.
So adult is less than a quarter, but the kids need to be even more smaller, right? So a dime, less than a dime. Okay, if bigger than a dime, the size, and we should file a report. Hey, you know what? It's a little bit more. Okay, it's not good. Okay, so how is the other thing? How we monitor with the after we do the catheterization? Usually for the pediatrics for the kids, the cardio catheterization they'll use a growing. They don't use the arm. They use the growing most likely. So, what should we check?
Color.
Could be color. Yeah, very close. Besides,
Rash?
huh?
Rash?
Not a rash. Not a rash.
Redness?
Not a
Monitor
redness.
for infection.
Infection that will be after. Will be after. So you're very close to the answer. You're very, very close to the answer. One thing you did not say. What will happen to the leg? What kind of complication maybe will happen?
Swelling?
Edema.
Swollen edema is showing what? What kind of symptom?
Capillary refill.
Capillary refill is about what?
Mm.
You're very close. You almost hit it.
Heart failure?
No, I cannot tell you the answer. That's why you have to guess. Okay,
Um,
but you're actually very close.
Swelling?
Huh?
Fluid retention. I don't know.
Not fluid retention.
Swelling.
Not edema, not fluid retention. When we have a fluid attention or edema to the leg, okay, so what kind of symptom we cannot testing? We don't feel it. Just like an adult. After cardiolization.
DVT?
Not DVT, not yet. Yeah. If
Dehydration.
it's all like a swelling to the leg or arm, and we need to check something. It starts with a P. P.
Pulse?
Yes. Thank you so much. Thank you so much. So remember after the cardiolization from the beginning, after this kind of like procedure. So if we do not feel the pulse, that means something wrong. Okay, it's blocking the circulation, and after that will cause edema, and after that will have some kind of like infection. Maybe infection usually is caused like maybe about day 2 or day 3. But the first day, if no pulse, that means it's dying, and that leg is dying. We need to tell the doctor. Okay. All right, number 7, the high calorie feeding formula intervention. Here again, do we dilute the formula?
No, unless it's with the mother's breast milk.
Yes, thank you. And feed the formula first or the breast milk first. Which one we should go first? If the doctor have this kind of two older, we also want to encourage the mother still do the breastfeeding, but unfortunately, baby is kind of congenital heart disease, so skinny. We also need to have extra formula. So which one we give first?
Formula.
Breastfeeding.
We give a breast milk. Yeah, the reason we get a breast milk is providing the boundary, the bonding with the mother and the kids, and also another thing is that the breast milk inside we do have an antibody for the baby. That's why baby doesn't get sick because they're still receiving the mother's breastfeeding with the antibody. And then in the between we give a formula. So that means the formula in this point is it become like extra, it's an extra nutrition. Do we add any kind of like sugar juice? We just say that.
No.
No, we don't. Okay, it's kind of like a diluting. Okay, don't dilute it. Okay, mixed formula with a breast milk, is that okay? Yes. Yes, this is okay. Okay, that's okay. Don't mix it with some other thing. Mix it with the breast milk. That's okay. Okay. So this is kind of extra information I did not mention about in the class. Okay, that's why I put it out. All right, rheumatoid fever, the long-term care and intervention. So what should we do if the kids have a history of a rheumatoid fever? They've been
Antibiotic.
Antibiotic? Yes. That means what? We are expecting this kid maybe will take an antibiotic for a while. Okay, for a while, for a couple of years, maybe until when they're just growing up, until they become like everything mature, like a teenager. Okay, that's why we need to tell the parents. Okay, tell the education to the parents. So your kids have a rheumatoid fever before, so that's why we are worried about maybe will affect to the heart and also kidney. So that's why your kids maybe will taking the antibiotic for a while, for a couple more years. Okay, Kawasaki disease sign and symptoms. So they all that apply.
Red tongue.
Red tongue, yeah, like a strawberry tongue. That's very
Strawberry
typical. Yes, that's very typical. And what else? Do they have a fever?
Yes, for more than
Yes.
5 days.
Yes, they do have a fever, and it's kind of like an unresolved fever, or fever have like a couple of days, like maybe 4 to 5 days. Okay, even you give lots of antibiotic or you get a Tylenol, and it's not resolved very well, but we still have to give. Okay, we still have to give. And what else?
Red eyes.
Yeah,
They
red
have a red
eyes.
eye, but is their red eyes is some kind of infection? Do they have a discharge?
Conjunctivitis?
No.
No, it's not conjunctivitis. They have a red eye, but it's not an infection. So that's why they don't have a discharge. They don't have a pus. It's just red. It's just red eyes. Okay? And what else?
Swelling palms and sole. Pits.
Yes, thank
Yeah,
you.
so-
So the palm and sole and it's kind of swelling and edema. This is also another very typical sign and symptom. Other disease, they don't have this. Okay, so most likely you get it, and so some other maybe also have some kind of like a rash, and what else?
Skin
Yeah.
peeling.
Skin maybe have some peeling, yes, maybe, but it's not for every kid will have a skin peeling. Okay, but most likely is a tongue, and is a sore and palm, and the fever. Most likely is all this kind of sign and symptom. Okay, and the fever so many days. All right. So number 10, be aware. So if the kids have influenza and the varicella, so will cause the Rhea syndrome even more easily. Okay. So what causes the Rhea syndrome? What happened if the kids they just got a Rhea syndrome? Something happened. They did something, or the doctor did something to them. Yeah, you say that. What?
Aspirin. They give them aspirin.
Yes, because they didn't check the kids very well. They just give aspirin, right? So the kids, maybe their liver is not functioning well. So that's why they cannot digest the aspirin, this medication. That's what will cause like your brain have an edema. And also your liver is kind of like a failure. So that's why we call this is a Rhea syndrome, and it's especially happen to the kids. But here is a big problem. If this child is infected by influenza and also varicella, so if unfortunately just touch a little bit aspirin will cause the Rhea syndrome even more easier. Okay, this is something I also forgot to tell you. Okay, so this is the reason why the children they need to get the influenza and also varicella vaccine. They have to get it because we don't want that in the real life. Maybe the parents just suddenly forgot. Okay, they just go buy some aspirin for the kids and they just take it. So this is the reason at least it's not going to be so severe for the Rhea syndrome. We still can save their life. But if unfortunately the kid just get influenza and varicella, that's so easy, and they also touch the aspirin. So that means they probably have a Rhea syndrome very easy. Okay, need to be in the hospital right away. Okay, so this is kind of extra information. Just remember this. Okay. Number 11, the Z-trap injection. Okay, also this is also another thing I forgot to tell you. Okay, so remember, so Z-trap we draw the iron, right? So the iron, this medication will be kind of like a storage in an amper. Amper, yes, not a vial, it's amper. So that means you need to break it. So this kind of amper, if you draw the medication, you have to use the filter needle. You have to use a filter needle to draw. You cannot use a normal needle. You can have to use a filter needle. So after the filter needle, and after that, and then we switch back to the injection needle, and then we give the kids a Z-trap. Okay. Yeah, so
Okay.
remember this is very important information. Okay, we use the filter needle first, and then we change back to the injection needle. All right, number 12, the sickle cell crisis education. So the patient want to prevent a sickle cell crisis, or also they're going to be discharged from the hospital. You're going to teach them how can prevent it and how can management. So how can we do the sickle cell crisis education? How are you going to tell the parents?
Low stress.
No stress, that does trigger, yes.
Mm,
How about the hydration?
yeah, hydration.
Yes.
Hydration, they need to hydrate, okay. Yeah, if they're going
Temperature?
out, huh?
Temperature?
It could be the trigger, yes. If they have a fever, it could be trigger. So that's why, it just we should not say temperature. We should say the fever. We should say the infection, or when they get sick. Yeah, when they get sick, when they get infection, they have a fever. That's why will trigger the sickle cell crisis easy.
Control pain.
Control the pain, yes. So remember, if you feel like a pain, don't wait until so much pain. So give a pain medication a little bit earlier. All right. And how about the exercise? The impact exercise, is that good for the kids?
No.
No. Okay. Do not do any kind of impact exercise. Okay. The cardio exercise, the aerobic exercise is okay. It's good. So usually for these kids, like a sickle cell crisis or hemophilia, so they're doing exercise kind of like by themselves, like a yoga or some kind of swimming and not hiking, like running or jogging for them. Okay. Not just a team with other people have like impact or competition. The competition. Again, that's not good for them. All right. So 13, hemophilia, the genetic transmission rate of the children. Okay. I never ever asked you guys this question for like the genetic rate, but unfortunately, Uncle has asked this, so that's why just trigger me. I just remember. Oh yeah, I need to give you guys at least like a couple question about this. That's why you will know. So hemophilia, this disease is going to passing to the boy or to the girl. Is the boy will get it or girl will get it?
Boy.
The boy.
Boy.
The yes, the boy. It will affect to the Y, the chromosome. Okay, affect to the Y chromosome, not like S chromosome. So that means what? So for example, so hemophilia, if it happen to the girl is become like a carrier. The girl doesn't have any symptoms because the girl doesn't have a Y chromosome, but the girl will carry with this kind of like a chromosome, the sick one, the chromosome, the S chromosome will pass to her child. If her child is the boy, and the boy will get it, the boy will get it. Okay. So the question, I'm gonna give you a big hint. Okay, so you go home and calculate, see how many percentage for this question. Okay, so that's why you'll get an answer. So the question is asking you. Okay, the mother is a carrier. So that means the mother, the both S chromosome, the S and S, both is carrier, and the father is a healthy father. Father does not carrying any hemophilia. So they're asking, so how about their children? So how many percentage is going to carrying hemophilia? This disease.
50.
I don't know the answer. I cannot tell you.
50%.
I cannot tell you. Okay. So that's what you
I mean,
calculate.
right or wrong?
I cannot tell you either. So you will not, everybody will know answer. So you calculate, okay, use a chart and calculate. Either way, you can Google or use the AI. So they will teach you how to just calculate with this question. Okay, this is not difficult. Remember, I show you all the picture, right? So when you going back to see the picture, okay, so you are gonna understand a little bit more easy. All right, 14. So what kind of isolation of a leukemia patient?
Standard.
No. Is leukemia?
Sterile.
It doesn't have to be sterile. It's not sterile. We need to use all the equipment sterile for that. But for the,
Protective?
yes,
Immunocompromised.
immune compromise and also protected isolation.
Protective isolation.
Yeah, we want to protect this patient. That's why we say it's a protected isolation. We used to be call this is kind of reverse isolation, but we don't say that anymore. We say it's protected isolation. All right, let's talk about the protected isolation. What kind of PPE we should use? We need a glove for sure, right?
Yes.
Okay, how about a mask? What kind of mask we use?
Yes.
Do we have to use
A
a
regular
90?
mask?
Do we need to use a 95?
No.
No, we
Surgery.
don't need to.
No.
Surgical mask. Surgical mask. Okay. And it's up to you if you are wearing a face shield or goggle. Okay, it doesn't matter. But also wearing a gun may be necessary, right? Okay, so this is the PPE. So how about the room not the room, the pressure? Is that positive pressure or negative pressure? Most of our isolation is a negative pressure. Okay, but the protective isolation, if this is a positive or negative one?
Negative?
Positive. It's a positive. So protective we have a two isolation is a positive. Okay, it's a positive air pressure. So one is a protective isolation, and the second one is the airborne isolation. That one also no, that one is a negative. Sorry, that one is negative. So which one is a positive? I think immune compromise only, yeah, immune compromise and also protective isolation. These two is a positive one because we want to protect the patient. That's why it's a positive. We don't want any bacteria stay inside the room, so that's why we just send the bacteria out of the room. That's why it's a positive. Okay, so 15, HIV vaccine contraindication. So if a patient have HIV, so the vaccine have a contraindication for them. About what? We encourage the
Live
HIV.
vaccine.
Yes, cool. Live vaccine. Okay, if this is live vaccine, so the HIV patient cannot get it. They cannot get it. Okay, because they are gonna get sick very very easy because their CD4 is low. Okay, so that's why you can Google and use the AI to check what kind of vaccine is live vaccine. Okay, we talk about that in term 2, so you can have some idea the live vaccine. All right, 16. Sixth, prevention.
Back
Some,
to sleep.
yeah, on the bed of sleeping and the face up is called a supine position. Okay, supine position, not a prone position, supine position. Okay, also what else? Is that good? We put like a small towel or small blanket? Yes, not good. How about a toy? The stuffing
No.
toy? No,
No.
not around the kid. Okay, how is the kid sleeping? Sleeping with the parents or sleeping another
A
bed?
bassinet.
Yeah, we can put it. The best bed is a crib. Okay, put it in the crib, and that's why next to the parents. Okay, do not sleeping with the parents together. Okay, this is a little bit dangerous. That's why we don't like it. Okay, good. And 17, post-tonsillectomy nursing intervention. So the kids have a tonsillectomy. So what's your nursing intervention?
Monitor for bleeding.
Yes. What kind of sign symptom is bleeding? Is a bleeding sign?
Frequency.
Swallowing.
Frequent swallowing.
Yeah,
Mm,
frequent swallowing.
swallowing.
Okay. If you find out the frequent swallowing is too much often, so what should you do? You just keep swallowing, like every like a couple minutes, keep swallowing. So what should you do?
Notify provider.
No, before notify provider, we do something.
Check for bleeding.
You cannot really see it because it's inside the mouth. It's deep.
Check for blood
Oh,
pressure.
the head,
Yes.
elevator head.
No, Oscar say that.
No?
Okay,
Oh.
say that already. Check the vital sign. Because
Oh.
because they're constantly breathing, you keep swallowing, right? So the patient maybe is breathing, and maybe he's going to have a shock very easy. They're losing the blood. So that's why check the vital sign first. See is anything change? How is the blood pressure? How is the heart rate? And then we report back to the doctor. Okay, tell the doctor, hey, you know what? I think the patient is breathing because now vital signs are getting lower right now, and the heart rate getting higher, and he keeps swallowing. Okay, all right. So is it this kind of the patient tonsillectomy and we can gargling with normal saline? Gargling with the
Yes.
normal saline is kind of like a prolong the discomfort, right? Okay, but remember something I always tell you, okay, if the patient they want to gargle with a saline, like room temperature or like a warm saline is okay. Do you think that tonsillectomy patient use like a warm saline or hot saline is good for them?
No.
No.
No. Okay, room temperature maybe is okay, but like a cool saline, okay, we like to use something cool for them because it's tonsillectomy. So the suture is there. So use the warm something is very easy to rupture the surgical site. All right, and also the food. So what kind of food they choose usually is better.
Softer. Yeah.
The food.
Soft food.
Soft food or chalk food, right? How about the spicy food and also acidic food?
No.
No. Okay,
No.
be careful the acidic food. Okay, be careful acidic food. This question have acidic food. They will tell you, okay, this food is acidic.
Smoothie.
Huh?
Ice cream.
Ice cream maybe is okay, but vanilla pudding is not good. Why not?
Oh,
Ice cream at least, ice cream provide a
liquid
very good
milk.
color. We don't read like ice cream for the tonsillectomy, but the doctor will agree that yes, we still can give, because ice cream is cold, and also ice cream have a lot of calorie. Because this patient have difficult swallowing, that's why they don't want to eat. Yeah, but how about the vanilla pudding? That's
No.
not a good one. Can you imagine what's the reason now?
Uh, it's kind of thick.
Yeah.
Thick.
So the problem is because both ice cream and vanilla pudding, they both were cold on the surgical side, on the tonsil. So that's why we don't want anything on the tonsil, the surgical side. So that's why we don't really encourage them to eat the ice cream and also vanilla pudding for the surgical side intervention. But actually, we have another solution. They can eat after they kind of like drinking the water, like washing the water. That's why we'll wash out with all the coating on the surgical side. So that's why no ice cream and no vanilla pudding on the surgical side, because you can just encourage you to just drink some water, okay, after they eat this food. Okay, understand? All right. So be careful. I told you acidic juice. Okay. No, I said juice already, so you know. So some juice is acidic. Some juice is not acidic. Be careful. Okay. What kind of juice for sure 100% is acidic. That's why we don't want it. But some juice they are not acidic, so they can drink. They still can drink. Okay. All right. Number 18. Okay. Acute epiglottis intervention. What happened to these kids if they have an epiglottis?
Dysphagia?
Dysphagia, yes, but most likely one thing is more danger.
Airway?
It's also this, the difficult something. They're difficult to swallowing, also difficult for what?
To breathe.
Yes, breathing. Breathing, because it's all edema and swallowing in the airway. It's kind of covering by your airway. Remember, I showed you the picture. It's all swallowing, right? So that's why sometimes the doctor even need to do the incubation. Need to incubate the patient by the vocal cord area to the airway, because it's so swallowing. So that's why your intervention is you need to maintain the patient's airways or pattern. If it's not, you need to call like the surgical team, get ready for the incubation, maintain their airway. Okay, that's an epiglottis. Okay, we can give some pain medication and also something for like a fever, like a Tylenol. Okay, and start with the IV fluid, because for sure they cannot eat and drink. That's why they will be NPO. So that's why with IV hydration, with some kind of sugar for them is good. All right, and also because of this kind of inflammation, we can also can use some kind of like a steroid medication. If other medication is not working, also antibiotic. Okay, 19, cystic fibrosis intervention. So how can we give the enzyme? So what time when we should give the enzyme? Before or
With
after
the
the
meal?
meal?
With the
food.
meal, with the
With the
snack.
Before and with the meal.
With the meal, that's good. But before or after meal, which one is good?
Before.
Before.
Okay. We don't usually give after the meal, okay, because your food is kind of digest already, and or either way, you have a diarrhea without an enzyme. So that's why it's uses you give an enzyme after that. So do we still need like a fat solution vitamin?
Yes.
Yes. It doesn't matter if you get an enzyme or not. Okay, the patient is gonna have like a lack of the ADEK, so we still need to give the vitamin. When do we perform like a chest and physical therapies?
Before the meal? After meal?
Before, not after. Well, if they have a sick mucus, that's why they have a difficult to swallow. So that's why after the meal, that kind of like it's not working. They won't have a better eating. That's why before the meal, we just do like a physical therapies. But also another time is also very important when the patient just wake up in the morning, because the whole night long they maybe have lots of mucus that are plugging out in the airway. So that's why when the patient just wake up in the early morning, that's why we suction the patient. We do like a physical therapies and then we suction them out with all the mucus. All right. So that's why this is go another the next one. Do we give the nebulizer bronchodilator? Do we still give it?
Yes.
Yes. Okay, it's a good practice before the meal or in the early morning. We give the bronchodilator. That's why they can stop over the day, and also they can eat better with their food. That's why they don't feel like they're choking. Okay, 20. So MDI with a spacer using. So how can we use a spacer? With when the patient just using the inhaler. So how we shake with the inhaler?
5 seconds.
And
At least
10
and
times.
shakes.
it is 5
10
seconds.
10
Yes,
times.
10 times. If they don't give it a 5 second, remember shaking like 5 to 10 times. Okay, so they both the correct answer. Okay, we would like to use shake like a 10 second, if not 5 second at least. So if we don't have a timing, that means 5 to 10 times you shaking. Okay, shake it well. So we rinse the mouth. Yes or no?
Yes.
Yes, always. Okay, and the first and the second popping the timing. So how we just give the first pop and the second pop? How long it should be between?
A minute.
1 minute.
5
Okay.
minutes.
5 minutes is a bit too long. 1 minute. Yeah, my PowerPoint highlight is already one is 1 minute. Okay, at least 1 minute. So that means what? Do not get a second pop below 1 minute. Okay, the patient is not kind of hold the medication in the lung yet. Fully is 10 yet, and you get a second pop already is a little bit too soon. All right. So watching like a mental medication container with a soap, is that good practice?
Yes. Yes. Can say
No,
yes.
actually we don't
Pretty.
we don't like it. Wash it with like a running water. That's fine. Just be sure. Make sure you just wash out with all the medication and not just collecting in the hole. For the next time we use, okay, it's a medication, it's a powder, so it's very easy wash out with running water. So that's why it doesn't really need a soap. The reason we don't want to use a soap is a chemical, so that's why it probably is gonna damage you to the pig. The peak of your specter. So this is the reason that's why we don't want it. Okay, the position when we administer with the specter. So what's the position for the patient?
Stay up. Stand up.
Stand up. Oh, maybe sitting is also okay. Yeah, stand up or sitting. Don't lie down. Okay, we don't tell the patient not lie down to inhale any medication. Okay, that's not right. Okay, so empty the lung, is that a good practice?
Yes.
Yes, always empty the lung. Okay, exhale with all the air out before you inhale all the medication. So that's why medication will go into the lung. Okay, it's not just when you spray and nothing just go into the lung. Okay, all right. So 20 question. Any question? Is anyone you don't understand?
Do you have midterm next week on Thursday?
We need to finish it with all the physical and then we'll go to the mental.
We don't have midterm next week. This week Thursday.
Mental. What do you mean?
A midterm. Midterm.
Oh, midterm. Okay, midterm.
Yeah.
I don't think we have a midterm yet, right? I think the Tuesday we have a quiz first. And I think the following week is a midterm. Next week.
Okay. Thank
This
you.
is what I remember. I'm not sure. I can check. Remember I give you the time. You remember the time? I give it to you. I write on the whiteboard.
Yes.
Yeah, it should be
Yeah.
there. Okay.
Yeah.
I think
White. Yeah. On the whiteboard, the day the midterm, and then this Thursday.
midterm is this Thursday.
Yes.
So midterm is 9, 7, 9, right?
Yes.
Oh, yeah, because we're gonna finish in 23. That's why we need to have a midterm. Yeah, I forgot this. Yes, now that means we need to have a midterm. We need to have midterm 7, 9. Okay, sure. I need to start making with your ATI question.
Yeah. Thank you. And then we're gonna get the study guide.
Yes, we will. Yeah, for sure. Yeah.
Okay. When?
You will you will try first. Let me make a PowerPoint first, okay? Without the PowerPoint, you have nothing can study, okay? So that means,
Okay.
that means probably I can give you the study guide maybe Tuesday. The day maybe when we have a class, okay?
Okay. Thank you.
All right.
Mr.
So
Patrick, did you send the study guide out? The study guide right here?
this study guide, yes, I sent to everybody. That's why from the beginning I asked everybody if you have a study guide.
Is it in the school email?
Fiona, I'll look.
Yes, school email. Go
Oh,
check your
okay.
school email, okay? Check your school email. It should be in your school email.
I'll send you right now.
Okay. So 20 question. We're gonna have a quiz on a Tuesday. Okay. This is a very busy semester. Okay, very busy term. So that's why everything is so in a hurry, so quick. All right. So
Thank you.
okay, you're dismissed. Okay. So I'm not gonna check the attendance today. Okay, because today we just review. It's not really the class. Okay. All right. So go study a little bit and good luck. Okay. I will see you Tuesday.
Thank you.
Thank you.
Thank you,
Thank
guys.
you.
Thank you.
Thank you, Ms.
Bye.
Patrick.
Thank you, Mr. Patrick. Good night.
Can